Empowering You is intended to provide you with information about complementary practices that may enhance your personal wellness journey. Some of these practices have been shown through clinical studies to be effective, others have not. It is entirely up to you to use this information to make the best choices for you as an individual based on your beliefs and healthcare needs. You are encouraged to consult with your primary care physician before engaging in or practicing any complementary services. Hi, I'm Lori Walker, and welcome to today's edition of Empowering You. Empowering You is intended to provide information about a variety of practices that you can use to enhance your personal wellness journey. Topics will cover alternative treatments, movement, nutrition, meditation, and creative therapies, to name a few. Today, we welcome Sally Ceplina to talk to us about Body Talk. Sally has over 20 years' experience in the professional, medical, and natural health fields. She is a certified Body Talk practitioner and also a certified natural health professional. She is also currently a student at Parama College through the International Body Talk Association and studying to become a Body Talk Access trainer. She's a member of the International Body Talk Association and currently practices at Facilitated Healing Wellness Resource Center in Watertown. Welcome, Sally.
Hi, Lori. I'm excited to be here today and to talk to everyone about what Body Talk is all about.
Okay.
And I've always been interested in science and healthcare and how to keep ourselves healthy, so that's been an interest of mine. And then when I discovered Body Talk, I knew that it was going to be life-changing.
Good. So what is Body Talk and when did it get started?
Body Talk got started in the mid-1990s. It got started because Dr. Veltheim had the Epstein-Barr virus, and nothing that he was trying with other treatments was helping him to recover. So he and a colleague decided to develop the Body Talk system because of that. And now it's represented in over 40 countries, in 10 languages, and we have over 250 instructors worldwide.
Nice. So it's one of the fastest growing healthcare systems in the world. And it addresses the whole body on levels of the physical, mental, and emotional and spiritual levels. Can you go into a little further depth on that?
Sure. That's what's really great about Body Talk, because it does address the whole body and all the body systems on all those levels. In life, we're all going through so much stress, and that stress is causing a breakdown of communication within our bodies. So because of that, this is what Body Talk is able to help with. We have this internal intelligent wisdom inside of our bodies, and sometimes we call it the innate wisdom of the body. So with this innate wisdom, that is what we're tapping into when we're doing Body Talk. And an example of this would be if we cut ourselves, our body uses that innate wisdom. It knows exactly how to heal that cut, send all that energy to heal that cut so we don't bleed to death. So that's just one example.
Okay, so that's somewhat of the physical. Talk about a little bit more of the mental, emotional, and spiritual aspect of what Body Talk can do for you.
Okay. Well, mentally, people can be under a lot of anxiety and come into the office and because of that stress. Body Talk techniques actually help you to calm down and give you that overall feeling of wellness and calmness. That's what I first experienced. And emotionally, that's in that category then too, mentally and emotionally. On a consciousness level, Body Talk works with the emotions that we experience, like the top 5 in Chinese medicine: the fear, the worry, the anger, and those are some of the main causes of consciousness of our emotions. But then it goes into details with the emotions too, and how we can actually remove the emotions that are inhabiting certain body parts and causing them to have physical problems. So it works at that level, at the cellular level.
Okay, so it's really getting all of the components to work together more
Together.
efficiently?
Mm-hmm.
Okay.
And spiritually, it's like keeping you in good spirits. It brings that joy back into life.
Okay. So who can benefit from a body talk session?
Mm-hmm. Well, everyone can benefit from body talk, from young to old, and even during pregnancy. And athletes can benefit because it can help them, especially if they're injured, the recovery time. By doing body talk sessions, you'll have a quicker recovery time. If you're going to have surgery, you could have body talk sessions pre and post surgery. It would prepare your body for the surgery. Hopefully you'd be more calm. And then the surgeons have also witnessed how much easier the surgery goes with the people that have had body talk sessions. And then the recovery time, they notice how much the recovery time has really speeded up the recovery time through body talk.
Mm-hmm. Mm-hmm. So would you describe what a body talk session would be like?
Okay. So with body talk, there's no medication. We don't diagnose. We don't use needles. There's no manipulation going on. So it's a real gentle process. First of all, I would do an intake form with someone coming into my office, and we would go over their wellness history. And after that, I would tell them about how the body talk procedure works. So there's 3 basic steps in the procedure of body talk. First of all, we start asking the body questions to find out what the body wants to work on and in what order it wants to work on those situations. So by asking the body the questions through the protocol that is set up through the body talk system, we will get yes or no answers. And we use a neuromuscular biofeedback. So with the arm muscle, we will get a response, and we'll get a yes or no response through the arm muscle. And so that's indicating where we're going to go in the body. Then the second step is a linking process. With the body parts, we're always finding different parts to link together to reestablish that communication. So for instance, perhaps someone might have diabetes and have blood sugar handling problems. So maybe their body might indicate like, oh, we need to work with the liver and the pancreas. Let's get them to communicate together and do what they need to do to keep the body healthy and to help with that situation of diabetes for that person. So we would hold those areas. And then the third step is this tapping process. So then we start tapping on the brain. And by doing that on the brain, it's sending signals to those areas that we're working on. And then those signals can start the healing process and the communication setup. So then, after that, we tap on the sternum, and this affects the heart area. By tapping here, the heart is able to store the memory. And by storing that memory, the healing process continues in the days and weeks ahead.
Fascinating. So how long would the benefits of one session last?
Mm-hmm.
How do you know that? How do you determine that?
Well, typically, if you're coming like into my office with pain, a lot of times you can feel that relief of pain even from one session. So it does vary with what the situations are, but sometimes in 3 sessions, that's all that's needed. Maybe 3 to 5 sessions, and you can feel a big difference. And
so what conditions do you find this to be most beneficial for?
mm-hmm. Well, all sorts of conditions. A lot of people are in pain, so I notice a big difference in relief of pain through body talk sessions. Okay. Some women are having problems becoming pregnant, and I've helped with that situation, and they've become pregnant, and when they've tried perhaps other modalities. So smoking, I know a lot of people are trying to quit smoking, and I've also helped people be able to do that through body talk sessions. And then with the athletes, like I said before, it's great to see them have, a quicker recovery time. And we have practitioners that are medical doctors, chiropractors, physical therapists. They all combine Body Talk into their practice. And we have one practitioner in Orlando, Florida, that's working with professional athletes. And so he has a lot of wonderful stories to tell.
Okay. And as far as neuro kind of diagnoses, different diseases that involve, the brain, what can you speak to that a little bit and how that's beneficial?
Sure. Body Talk has a lot of techniques that do help the brain. And cortices, I'll mention now, is one of our first and most important techniques. So I'm just going to let you know that you can go to the website, bodytalksystem.com, and click on the videos, and then click on the video that is called Cortices. So it's a 12-minute video that Dr. Veltheim teaches you how to do this technique on yourself, and then you can do it on others also. But this technique helps the brain mentally so that you have better memory, you have better mental clarity. It reduces the stress, so you have a less feeling of stress in your life. And so we recommend that you do this technique every day. And so I could say, get started with that technique.
Okay. And then you do individual treatments with people. Do you teach that as well? Okay.
Yeah, once a week I do teach an introduction class, what Body Talk is all about. And then I teach the Cortices technique in that class.
All right. Wonderful. So how can people help themselves, family, or friends with Body Talk?
Okay, Body Talk also has a wonderful class called the Body Talk Access class. And there's also a book called Body Talk Access. This book can be ordered online through the bodytalksystem.com website. And this class is a one-day class that people can take. And in the class, they learn 5 techniques plus a fast aid technique. And with those techniques, they can help themselves in about 60 to 70% of things that go on in a weekly basis with our health concerns that can cover and help themselves through that. So these techniques can help viruses, allergies, help keep our body hydrated properly using the water that we drink properly into the cellular structure. But the first 2 techniques actually do help the brain a lot.
Okay.
And then the 5th technique helps our structure, our muscles and our bones. And by doing what we call reciprocals, it helps the body with alignment and relieve pain.
Okay.
And then the fast aid portion of it is what do you do when someone's just injured, perhaps even if it's a medical emergency where you need an ambulance. You can still start doing the Cortices technique and this fast aid technique.
While you're waiting for the ambulance
While you're
to
waiting
arrive.
for that.
Call 911 first, then do this.
Yeah.
Might be calming to the injured
It
person.
is very calming, yes.
Okay, and that can play a big role in how they handle their treatment.
Right, in medical emergencies. And soldiers that know how to do this bring their fellow soldiers out of shock during emergencies, and that's big for the body to be able to recover, bring the brain out of shock. And there's an example also in this book. There's a lot of examples. But one other example is a couple of nurses in 2 different hospitals actually were working with coma patients. And by just doing the Cortices technique, these coma patients were coming out of their comas.
Interesting.
Yeah.
Very nice. You said earlier that you had some excerpts to share.
Oh, this is in the Body Talk System book. You can also order this online at the bodytalksystem.com website. And this gives examples, and it actually talks about the whole Body Talk system, some of the procedures that we do. So I just wanted to give an example of 2 people that have come into Dr. Veltheim's office. So he writes about Carol, that she arrived at his clinic justifiably distressed. She had been told by a medical specialist that she had only a few days to live, and there's no help they could offer her. Carol had a form of vasculitis that had been treated with massive doses of cortisone without results. She had parasites throughout the vascular system that were destroying the walls of the blood vessels. That was causing the blood vessels to hemorrhage. So while there was evidence of this hemorrhaging under her skin, the main problem was the internal hemorrhaging. So that was causing her to slowly bleed to death. Well, the Body Talk treatment enabled her immune system to specifically target the parasite problem and its underlying causes. So within 9 hours, all of the parasites had been destroyed by her immune system. She fully recovered within a few days, and Carol is now a Body Talk practitioner. So
Wonderful.
that's one example. And then we have Pam, who's 62 years old. She fell down the stairs. She was unable to turn her head from left to the left or to tilt it backwards. So for 2 years, despite extensive therapy from a variety of practitioners, she was told that the combination of arthritis and age would stop her from ever regaining her mobility. After 10 minutes of Body Talk treatment, the range of motion in her neck had improved 70%. 2 more treatments restored the full range of motion, and now Pam is pain-free. So there's many examples that people have of how Body Talk has helped them.
Okay. And for you personally, I know you said you've always had an interest in the science and the healthcare field. As far as treatments yourself and what it is like for you to give treatments and see these kinds of results, just tell us about that a little bit more.
Okay. Well, I do the Body Talk access techniques on myself. And I feel that that really helps with my mental clarity and that overall feeling of wellness day to day. And the body chemistry technique that you learn in that process helps with viruses and bacteria. So I know, like in the winter, if I'm being hit by a virus and I have the symptoms start, within a day after doing the technique, I can have a recovery. So I notice the recovery time is a lot quicker. Or maybe I don't even catch the virus that people are spreading around. So that's one example. So I like doing the techniques. And I do get Body Talk sessions done by other practitioners also.
On a regular basis?
I do,
Okay.
yes.
Good. And for you as a practitioner, tell me a little bit more about your journey into becoming a Body Talk practitioner.
Okay, my background was in nutritional consulting, and I started an interest with that in the 1980s. I had an uncle who told me about natural wellness, and he was taking me to natural health conferences, and they were in Chicago. And so I started learning about nutrition and studying herbal medicine and some homeopathic medicine. And that's the path I was on, trying to help other people through nutrition. And then when Body Talk came about and I heard about it, I just felt like that was a missing link. Like, wow, how much, life can change so much better through Body Talk and how it did. It was just like, it just was the missing piece to a more, becoming more healthy.
Okay.
Mm-hmm.
Okay. So as I listen to you talk, I think about this engaging the energy within us between the different parts of the body. Is that how you would kind of summarize this?
Mm-hmm. Right. So the breakdown of communication within the body systems, our organs, our endocrine system, our body parts, and Chinese philosophy and medicine also will work like with the meridians, just like they do in acupuncture. So we can help balance the meridians and have that wellness effect on the body. Mm-hmm. So it does touch on different emotional areas too. Sometimes stressful situations cause us to have like an active memory being stored within our body. With that active memory, it's causing problems and fears and phobias that we can continue to have throughout our life. And Body Talk can address those. It can go in, find out about those active memories, and actually do a technique to clear that. So it relieves people of their fears, their phobias. Certain stressful situations that have happened as events in their life. We'll go in, the body will let us know about this event that took place, and the technique will actually clear that out. And then it allows the brain not to have it stored as an active memory. You don't keep thinking about it. It's just like something in the past. If you reflect on it, there's not that charge that brings back the fear or phobia about it.
Okay, very nice. Now, from my personal experience, I did learn the Body Talk Access treatment, and by taking the class, and in one of my sessions doing massage, my client started with her restless leg syndrome started to kick in. And so I did the tapping that we learned in the Body Talk Access, and it was interesting because almost immediately her leg calmed. And then when I would switch positions, she said it felt like a zing or a zap kind of go through that leg, and it would jump a little bit, but then when I got back into it, it immediately calmed down again. So it was very interesting. It was the first time I had used it on someone else, and I was very, very pleased with the kind of immediate results. And then I went ahead and I did teach her how to do just what I was doing, and I have not met with her again to know how successful she was with it, but I'll be waiting to talk with her again and see how that goes for her, how that has gone for her.
That's so wonderful to hear.
Yeah, it was very fascinating. I was very fascinated by the quick results, and she was very astonished by the results and it happening that
Great.
quickly. So,
Yes.
and that's just the 1 hour class that you offer once a week. So, and how much training was involved for you to become a Body Talk practitioner?
The International Body Talk Association trains practitioners. So right now there's a class called Modules 1 and 2, and they're about to change the name of that class as a fundamentals class in Body Talk. In September that name will change. But so by taking that class, it's a 4-day class, and that allows you to start studying and practicing. And then if you repeat that class or take an advanced Modules 1 and 2 class, then you can study for your exam to become certified as a Body Talk practitioner. And the exam is a written exam, and it's a hands-on exam showing so that you know how to do all the techniques. So however long it would take you just to do the studying and be ready for the exam, then you could be certified as a Body Talk practitioner. After that, there are advanced classes that you would probably enjoy taking also, and just learning more things that you can add on for your Body Talk sessions to help.
Wonderful. Okay. Well, thank you very much, Sally, for joining us today, and I encourage you to watch for further episodes of Empowering You.